Hi everyone, this is Dr. Frashone from the Immunization Program. This is your data update for the week. As of August 10th, nearly 70% of Chicagoans 18 plus have received a first dose of vaccine, and 52% of 12 to 17-year-olds have received a first dose. This is a huge milestone for Chicago. In June, I told you that we had 1.5 million adults to go to get to that 70% mark. And in 2 months' time, can you believe that we gave so many doses together? I think it's amazing. But as you know, the virus just won't let us slow down. Vaccination is more urgent than ever, as the Delta variant causes an increased number of cases across the United States. The highest number of cases and severe outcomes are happening in places with low vaccination rates. What we've learned is that despite some rare breakthrough cases, getting vaccinated helps prevent hospitalization and death. And it also helps reduce the spread of COVID-19 in communities. Here you see the weekly case rate per 100,000 by vaccination status, with the case rate of unvaccinated individuals in red and the rate of vaccinated breakthrough cases in blue. Both appear to be rising as the Delta variant becomes the dominant circulating strain. But the weekly case rate of unvaccinated individuals is rising much more quickly. Now look at severe outcomes. Here's the weekly hospitalization rate per 100,000 by vaccination status, again red being unvaccinated. The gap between unvaccinated and vaccinated here is much wider. And that gap is even wider when you look at the weekly death rates per 100,000 by vaccination status. This is the message to patients. What we see in Chicago is being seen across the country as Delta becomes the dominant circulating strain. Vaccination is the best tool we have to save our patients' lives. Every vaccine you give to adults could help them stay out of the hospital. And every vaccine you give to kids 12 to 17 can add another layer of protection for them as they head back to school and social activities. Here you see the vaccination rate in Chicago has stabilized over the past few weeks and might even be going up. 61% of doses given last week were administered by pharmacies, followed by outpatient centers. These also happen to be locations with a lot of missing second doses. Pharmacies have the highest number of missing second doses, and outpatient providers have the highest percentage of missing second doses. Here's a map of incomplete vaccination series by census tract. Darker blue is a higher percentage of missed second doses, which you can see is higher on the west and south sides. We're seeing the lowest rate of missed second doses since the campaign began at 5.8% overall. But we are seeing that the rates are high among people who have initiated vaccination more recently across all demographic groups and settings. The highest rates of missed second doses are among oldest and youngest age groups. Trends are similar among race ethnicity groups, but may be higher in some community areas. Running reminder recall reports is one way to tackle this issue and get people fully protected before a Delta variant surge. Reminder recall is an evidence-based strategy for getting patients back into the office that may have said no to vaccination before or missed their first or second appointments. Personalized letters, text messages, and voicemail work best to restart a vaccine conversation. So what can you do to get started? Running eye care reports will help you to target the right patients. A good resource to check out is the AAP Best Practices for Reminder Recall Systems. The eye care COVID-19 Reminder Recall training is now posted on the Chicago HON in the training section at chicagohon.org/BFC. You can run a report to catch missing first or second COVID-19 doses and make your outreach more efficient. If you find through these efforts that the barrier for patients is simply getting into the office, don't forget about the Protect Chicago at Home program. Any patient 12 plus living in Chicago and up to 10 household members can get Pfizer or J&J vaccine at home by calling 312-746-4835 or have them register online under the Programs tab at chicago.gov/COVIDvax. If you want to learn more about the 3 steps to take to improve your site's COVID-19 vaccine coverage ahead of the Delta variant surge, watch the next video. Some quick ordering tips, since the manufacturers keep changing the rules on us. Since July 28th, Moderna is only available in a 14-dose vial presentation. Pfizer can be ordered in 450-dose per case units now. But if you don't need that many doses, we can hand deliver orders of 54 doses or more to you. Janssen doses now have a 6-month shelf life from the manufacturing date, and you can order these in 50-dose allotments. What we're learning is that you must check all expiration dates before tossing any vaccine, as these shelf life extensions continue to roll out. In other news, FDA has approved a 3rd dose for immunocompromised individuals, and we await an ACIP vote on the issue. Look for a health alert as this information becomes available. As always, thanks for listening and for making Chicago safer, 1 dose at a time.